Welcome back to Don't Breathe on Me. Today is May 7th. My name is Abram Hurt.
And my name is Ezra Hurt.
We're two brothers in Brownsburg, Indiana, staying at home for the most part and keeping our social distance. Today, we're continuing with the second part of our interview with Dr. Mark Collins.
Before we get started, we wanted to give a quick update over the coronavirus. On Monday, restrictions began to be lifted, including the stay-at-home order in most of Indiana's 92 counties.
As businesses across the state reopen, they must create a plan on how they will create a safe environment for employees and customers. Plans must include health screenings of employees, cleaning and disinfecting, providing hand sanitizers, wearing masks, and social distancing. Today, the state also began offering personal protective equipment to small businesses that have not been able to buy them.
The PPE marketplace will provide masks, gowns, and hand sanitizer to businesses and nonprofit organizations. The free bundles are available to businesses that are registered in Indiana, have fewer than 150 employees, and need the equipment as part of their reopening plan. They must also be a retail store, restaurant, personal services provider, or an office.
As of Wednesday, over 20,500 Hoosiers have tested positive for the virus, and over 1,100 have died. From CDC data, over 1.25 million Americans have tested positive for the virus, and over 73,000 have lost their lives.
So today, we're going to jump back into our interview with emergency room doctor Mark Collins. Let's jump into part 2. Today we're continuing our conversation with Dr. Mark Collins. Dr. Collins, how often are you coming into contact with the coronavirus? And how are you staying safe and ensuring the safety of your family?
Well, I would say every time I go to work, I come in contact with it. We have generally, I think I've had one or maybe two shifts that I can think of in the last 2 months where I thought I didn't see a coronavirus patient this shift. And I probably did because you don't know who they are, and you most likely saw someone that had it, but you just didn't know. So I would say basically every shift I come in contact with it. In regards to how I protect myself, they know me at the hospital as being very meticulous in my hygiene. When I get to work, basically I clean the entire area, my entire workspace. So I will get sanitizing wipes, either Oxivir, which are hydrogen peroxide wipes, or other brand of wipes that we have that have ethyl alcohol. And I wipe down the computer, I wipe down the phone, I wipe down my chair, I wipe down the desk, I wipe down my cell phone, I wipe down my stethoscope. Everything that I'm going to be touching and using during the shift gets wiped down and cleaned. And then once I'm satisfied, I put my stuff there. And the first thing that I do as soon as I go into a shift is I put on a surgical mask. And my hope is that others will do the same, because as I told you before, I'm not really protecting myself, but by doing that, we're protecting those around us. And there have been people at my workplace, doctors and others, that have gotten sick with the coronavirus. So my hope is that if all of us do the same thing back in the workstation that's theoretically a clean area, that we can prevent spreading it to each other. So I do that. And then other ways I prevent spread is I don't ever see, or protect myself rather, is I don't ever see a patient without wearing a mask. And that has helped me, I think, several times, because I've seen numerous people that I didn't think had the virus, and come to find out later they did have it. But I was at least wearing a surgical mask during that time, which is better than nothing. And I try to, I found that we keep our distance a little more. So I usually try to get up beside the patient and talk to them kind of a little bit more closely. I tend now to stay back at the foot of the bed at least. And if I'm talking with an older person who can't hear, and I have to get right up in their ear, I will stay behind them and just talk in their ear, so that hopefully they're not projecting stuff out on me. And the other thing, that one of the ways we protect ourselves is we try to ensure that people that come in have masks that we suspect could have it. So anyone in that area that's negative pressure, we make sure they have a mask as well. When we go in there, we're doing all kinds of things to protect ourselves. We wear so what I would do is I would go into the initial, what they call the ante room or ante chamber, and there you gown up. You put one pair of gloves on, you put a gown on top of that, a clean gown. You put a second pair of gloves on top of that locks the sleeve of your gown in. You have your N95 mask on with a surgical mask on top of that. And then I have a head shield with a visor that would hopefully protect me from any spray. And I have a surgical bouffant cap on that would hopefully keep the stuff off my hair. And then once I've got all that, I'm ready to go in, and I would go in and do my standard interview in the COVID area that we call it. And then when I leave, another part of protecting yourself is how you take your equipment off. If you don't take it off in a specific manner, you can become infected. So you have a specific regimen of how you take it off. So by protecting myself, hopefully I'm protecting my family. And that's one of the things when I come home, I try to take my clothes off and put them in a box. And basically, I have a kind of a ritual that I do. There's different people that do different things in that regard. It's hard. We haven't been doing, some people have totally gone to living in a separate area, but so far I'm not sleeping in the barn yet. So that's good. But we have a plan in case I do get infected. I'll have a specific area of the house that I'll go to and basically stay there and try to quarantine myself away from the rest of the family. So,
Thank you. How prepared or not prepared was the U.S.'s state and local level when it came to combating this pandemic? And do you have enough medical supplies at this point?
So I'll answer that in reverse order. So no, we don't have enough medical supplies for specifically masks. We're fine on ventilators. And specifically looking at the state of Indiana, the state has done a good job of being prepared in regards to the Indiana State Health Department. They have done a pretty good job of looking at this, getting ahead of it, and being proactive. They keep a count of the ventilators available in every hospital, and that's there. We have a website that we can look at and see who's got ventilators, who doesn't. And we've actually done pretty well kind of flattening the curve and keeping them getting overwhelmed. So in regards to like bigger stuff like ventilators and that type of thing, in Indiana, there's actually a good bit available, and we're not stretched as of this point. In regards to other things like basic stuff like your mask and that type of thing, don't have enough of those, but part of the problem is how we were using those. So when this hit, those were supposed to be single-use masks, and there was no way when you come in every day, every shift, you use those masks. There's no way that I think anyone could be totally ready for this without having switched our game and changed up how we do things. So I would say, no, there's not enough mask, and we are reusing that. And I have basically a brown paper bag at work, and I keep my N95 mask in there and my surgical mask and a face shield in there. And so when I go into work, I put that on. When I leave, I put it in there, I clean it, put it in there. You can have it disinfected. The hospital has a system to disinfect them. But that is not something we were doing before at all. So kind of getting back to the initial part of the question, was the U.S. ready? Were the states ready? No, I don't think any of us were ready for this. It's pretty obvious in the way we responded that we were not ready for this. This is something that is unprecedented. It's not been seen in our time. I believe the 1918 flu is probably the most similar, and that killed a lot more people. But it probably the most similar type of thing. So in our generation, in our time, probably in the last almost 100 years, there's not been anything like this. So it's definitely something we weren't ready for, and we were hoping, I think, as a country, and I know I was hoping that it would kind of stay over where it started, but it did not. And it did, like I said before, to use that kind of common verbiage, it caught us with our pants down. We weren't ready for it. But we have made some changes, and specifically some of the other areas we weren't ready for it were and I think one that would have helped us a lot would be testing. If we would have had the ability to test for this prior to its arrival on our shores, we would have been ahead of the game. And that's what Korea and some other places, South Korea specifically, did and invested in. And I think that does make a difference if you know who has it and you can quarantine them. This is a little tricky. Like I said, this virus is so hard because you don't know who to test. So unless you're testing almost everyone, you're behind the 8 ball. So testing was one area that we were behind in, and we were not ready for it. The equipment was one that we were behind in. And then, like I said, I think another area where we were behind is the government message that's been put out. So in China, they have a centralized communist government. Not that I necessarily agree with their politics, but they were able to shut things down fast. We were not able to do that here. And part of the not being ready is that when you have politicians taking the place of epidemiologists and sending out mixed messages instead of consistent ones, then you have problematic issues that arise, and those can mean lives lost in something like this. So I would say no, we definitely were not ready. There were some places probably more ready than others, but no is the answer to that question.
So you've already talked about how your knowledge and understanding of the virus has grown, but what were some initial approaches to treating the virus, and how has that changed?
Yeah, so that is probably a 2-day discussion because there's been so much change in medicine and so many different approaches and things that have been discussed, and especially from the emergency department and intensive care unit side of things. So initially when the coronavirus came out, so one of the things that I can personally attest to is we were very aggressive about treating, because it was thought that if people came in and they had low oxygen and they looked poorly, that they were going to need a ventilator, because we were hearing from Italy and other places that once you have people that get to a certain point, they just need to be put on the ventilator, and we need to get this done because it's going to happen and you need to make it happen. Well, we have totally changed our treatment in that regard. So early in March, I was putting people on the ventilator, and there were a couple of those that I was thinking to myself, maybe I shouldn't have done that. Maybe I should have waited, because now we've totally switched our approach, and now we're doing the most possible to keep people off the ventilators now, and to basically see if they will fly on their own per se. So these patients, when they come in, they are very low on their oxygen. And all of your training in medicine is that someone comes in and their oxygen saturation is 50%. So if oxygen saturation is just like a test at school. It's supposed to be 100%. You're making an A+, right? If you get to 90%, you're making an A-. Once you get into the 80s, we start thinking there's a problem here and we need to put this person on oxygen. Well, some of these coronavirus patients come in with oxygen saturations in the 40s and 50s, which is extremely low and extremely concerning. And in the past, we would say, this is a person that needs help right now, and we need to be aggressive and do things with them to fix them. Now we are actually tolerating a lot lower oxygen levels in the hopes that we can keep the patients off the ventilator. But also, we've learned that these patients are likely not benefiting from some of the things that we had done prior to the virus coming through, but had stopped doing because of worries that it would cause healthcare workers to be infected. So for instance, if someone were to come in with shortness of breath and low oxygen, we would normally utilize a machine called a BiPAP machine, a CPAP machine, or a vapotherm machine. That's actually 3 different machines that I mentioned there, or even just a non-rebreather or an aerosol. So there's many different ways we can help people's breathing. But we had stopped doing a lot of these treatments because there was concern, and based on research that I have done, it was likely unfounded concern that the virus would be aerosolized by these procedures. So by putting someone on this BiPAP mask, the thought was, when you do that, you're going to spread this virus all around. And so we can't do that. We just need to go right to the vent. And that's what a lot of people all over the country were doing They were skipping basic things that we've done in medicine for years and years and years in order to try to basically protect everyone from being exposed. Because if you expose everyone in your ER and everyone's sick, no one's going to have a place to go when they really need it. So ICUs and emergency rooms were doing a lot of different things. That has totally changed now. Now we're doing basically the same thing we used to do, and it's working. But we're doing it in a little different fashion. Now, if I put someone on a BiPAP machine, I have a HEPA filter on the exhaust port to make sure that whatever they're breathing out is viral filtered. And if I'm putting someone on the vent, there's a ventilation virus filter, which is normally on there, even on a non-COVID day, but we're much more cognizant about that. And then the vapotherm and other things, we're actually covering patients with plastic and when we do a nebulized treatment for asthmatics, we'll cover them with plastic or put them in a hood so that the aerosol does not go out into the room. But there's a lot that has changed from the beginning to the end, and that's just a few things. It's been amazing how fast things have changed and how quickly we have altered what we do, probably, like I said, for ill initially, because as is the case in most things, people react to things and they feel like we need to do something, we need to react in a certain way. But then you end up kind of calming down and realizing this is how we should be doing it, and this is more helpful. A lot has changed, and a lot has kind of come full circle in how we treat patients.
Thanks for that. I think part of this pandemic has brought a level of fear to everybody's lives. I know I've had some fears, but what are maybe some fears that you've been having, and how have you been handling those?
Well, I think, of course, when you go in and you're working directly with people who are ill and you know they have coronavirus, there's always the fear that you could be one of the small percentage of people, and it is a small percentage of people, who actually get this illness and die poorly, right, or die. But that's a real fear. But I think as Christians, we have the advantage of realizing that our day of death and our day of birth is known by our Creator. It's fully known to Him. It's not a secret to Him. And our times are in His hands. And that's a verse from Psalms. So when I first started going in, I initially had a little bit of apprehension and fear, but I have known this truth as an emergency room doctor I guess ever since I started as a paramedic and whatnot, when I really started facing life and death, like up front, life and death and suffering. You see people suffering and you see people dying and you're thinking, well, this is terrible. And you have to find a way to kind of rationalize it, but you realize that God is actually in control despite what you see and despite the suffering and death and everything that can inspire fear. We don't have to be afraid if we're trusting in Him, because He's got it. And even if we suffer, He knows that. And even if we get sick, He knows that. And even if we die, He knows that. But as long as we are trusting in Him and we're in His hands, then in my mind, we are in a much better place than someone who does not trust Him and does not have that faith. And so I've definitely had some fears that obviously one is, like I said, going and getting infected myself. Another big one is I don't want to infect my family or others around me, because it's not so much me. If you play the numbers game, if you think, well, I'm a fairly young person, I'm 43, my chances of getting this severely are actually pretty slim. But what I worry about is that if I get it, I'm going to actually infect someone and cause harm. That's what, as a physician, we're supposed to first do no harm. And so I always worry about that. But you can't even worry too much there either, because worry doesn't help things, but you can take precautions and you can do the right thing, quote unquote, by trying to protect others from yourself. And that's where I was mentioning the mask. The herd type immunity of everyone wearing mask is beneficial in that regard. So one of the ways that I have dealt with fear is actually being proactive. So initially when this came out, a lot of fear is based on not knowing. If you look at fear in general, so I mentioned the first thing there about faith helps me to deal with fear. just the general fear of death or illness or suffering. But the other thing to consider is kind of a more practical aspect. Okay, so fear, what is that, and why do people have it? Well, they have it a lot of times because there's the unknown. And when this thing hit, there's this huge unknown of what's going to happen to the economy, what's going to happen to people, and you have all these different facts circulating. Well, sometimes being proactive to deal with your fear is one of the best ways to mitigate that for yourself. So I remember when this first came out, I was like, I don't know a lot about this. And there was all these doctors on this listserv that we have, all the doctors that have graduated from the emergency medicine program at Indiana University where I went. And they were all going back and forth and saying, we're seeing this and we're seeing that, because it first hit out in Washington. So some of our doctors out there were telling us, this is what we're seeing. And so I was, a lot of that stuff is kind of fearful because they're like, man, they're telling us all this. And so the way I dealt with that is like, well, I'm going to educate, because if I know, the more I know, the less I have to be afraid of. And so that's what I did. I went and read as much as I could. And I spent a lot of time on my phone. My kids can tell you, learning and reading articles and getting my hands on whatever I could about this, so that when it came here, and it did finally, I was ready and I knew what needed to be done, and I could help the nursing staff be educated about how to take care of themselves and protect themselves. And so I think part of dealing with fear is actually becoming educated about what you're fearful of, how it can harm you, how it can't harm you, and how you can protect yourself. So that's one kind of rational step that I took, that you can deal with fear in kind of that way.
I really appreciate that answer. I know you're spending a lot of time in the emergency room, but what have you been doing to stay busy when you're not working?
Well, we were just outside splitting some wood before we did this Zoom session. I'm trying to spend a lot of time outside. I think it's, especially if you get a nice spring day, it's definitely does a lot of things for your health and well-being to get exercise, and to do kind of, for me, to do work that doesn't require a lot of mental gymnastics per se. So in the ED, in the emergency department, a lot of times I'm doing a lot of thinking, and I've got a lot of thoughts flying through my head about possibilities for patients, and it's a constant mental processing kind of burnout that you get, where it's kind of like running your CPU on high all the time, and that the fan's kicking on to cool it down, because you're constantly turning all those thoughts and things over. So it's nice for me to come home and to do some kind of just menial tasks that actually are beneficial but don't require a lot of thought. So for instance, we went out yesterday and we planted our garden. So went out and basically pushed corn into holes for hours, which was great. It was fun. It was just a fun thing to do, and it didn't require a lot of tasks, a lot of mental tasking, I guess I'd say. And then I was out in the barn doing some woodworking. I like to do that. And then I've been working on I have a sawmill that I cut up wood with, and then the kids and I will go out and we'll split wood for the winter. We'd like to get it split early so it'll dry in the summer. So just stuff like that. And then we've also been doing, as a family, we'll do devotions, and we're going through Ecclesiastes, and we're talking about things that matter and things that don't matter. And we do some family singing together, because God has blessed us with the ability to make music. And so we have done that. And that's been really good as well, because we are able to sing together, try to get everyone to sing, but some of them don't. One of them's looking at me now. So it's definitely fun. It's fun to do that. And we've done other things too. We've done a lot more Zoom. We're getting better at using this. I found that it's not the same as seeing people in person, but it definitely works, I guess you'd say. So those are some things.
Great. I think this is the last question we'll ask, and it kind of goes back to what you said about addressing fears. For people that are looking for some reliable resources with general knowledge and even staying up to date with the virus, what would you recommend?
So I would say the CDC website is a good one for general knowledge for the general public. It has probably a whole page devoted to this. And there's a lot of good basic knowledge there. So I would definitely refer to that. Indiana State Department of Health also has a website. So if you want something down to a specific state level, they can definitely help you out with their website, because they have a lot of like day in, day out stuff with the state and how this is affecting the state. They also have done briefings and things with the governor. And actually, a lot of my friends I've seen on TV doing these briefings, people that I graduated with, people that I know up there, because this has thrust them into the emergency physicians and thrust right into the kind of center of all this. So the Indiana State Department of Health website, the CDC website. For other kind of general things, like if you're interested in keeping up with case count or death counts or whatnot, that Johns Hopkins has a website that does that. I actually have gone. The Washington Post has something that is they keep a daily count of caseloads, and they show percent increase and decrease. But they're using the Hopkins website and putting it in a more user-friendly form. So there's several places that you can go. Those are the places that I have been going. From the standpoint of more in-depth stuff, if you really want to get down into the nitty-gritty and look at studies, like for instance, when I first started looking into this, and I was wondering, well, are we really at risk for having nebulized breathing treatments cause spread of this virus? You can go and look at PubMed.com, and that has a lot of actually it's PubMed.org, I believe. It's the National Institute of Health website. It's like a repository for all biologic medical type studies, and you can look at the nitty gritty like that. But that's not something for the general public that I think would be beneficial unless you are a scientist and have a little bit of background knowledge. But they do have some features there that are I think more friendly to non-scientists. So you could check that one out as well, the PubMed website. But those are the ones that I've been using predominantly. I don't use Facebook a lot. I wouldn't recommend that per se. There are some interesting things on there. In regards to the media, I would say it's a mixed bag. There's so much and this is part of the reason why I think politics is a problem during this, is if you put politicians on the front lines as the ones putting out the message, it can be divisive, because politics is divisive. And so during a pandemic like this, we need a more uniform message that everyone can get around. And so having like a scientist or an epidemiologist do that would be probably better. Granted, you need leadership. So it's important to have a politician at some point, but not on the front doing the kind of daily thing like the New York guys and the president have been doing. I think they really probably have done more of a disservice than a service in that regard in some aspects. So regardless, those are the places where I would go to find information. And my point in all of that rant was the mainstream media, you can get some good things from it, but some of the other things they put out there could be politically tainted or have other issues with them. So you'd have to basically kind of pick and choose and be careful about what you get out of those sources. So
we appreciate you taking time out of your day to answer those questions for us. And we want to thank you for the work you're doing daily. And we're looking forward to hopefully seeing you sometime soon.
Yeah, definitely. Hopefully soon. But like I said,
Yeah.
like I told my parents, just because they lift the restrictions doesn't mean the virus disappears.
Yeah.
Yep.
So if you can, I would tell people, make sure you're wearing masks, and then encourage others to do it, because I think that's one of the best ways we can slow this down and possibly let it burn out, is if everyone wears a mask, because then you're suppressing yours, and everyone else, if they're suppressing theirs, then we could theoretically get this thing a little better controlled.
We'd like to thank Dr. Collins again for the interview, and we'd also like to acknowledge those who are working daily to keep us safe during this pandemic.
If you have any thoughts, questions, or you would like us to try to talk to an individual, you can send us a message on our Facebook page, Don't Breathe on Me.
We'd like to thank you for joining us for our second episode this week.